Hello, this is Don,
And this is Gina with Focused Healthy Family.
and today we're looking back over the best of 2025.
So, over the course of the next week, we're going to share with you some of our favorite podcasts, some of the ones most enjoyed by others. And we want to wish everyone a happy holiday, a happy healthy season as we close out 2025 and launch into the new year. So, sit back, enjoy our show. Please share this with others. We're glad you've been here on this journey with us.
We talked with Dr. Julia Ward, who I've gotten to know, and we talked about natural healing. She's a naturopathic doctor and a medical doctor, and it was a really good conversation we had with her. So pay attention, it's going to be a good talk.
I'll tell you about a patient of mine that I started seeing a couple of years ago, and she came to me. She's in her late 40s, early 50s, and she was having fatigue, brain fog, not sleeping well, and couldn't seem to lose weight. Whereas before diet and exercise, she would lose weight, no problem. And this is somebody who, has worked out a lot. She was in the health or the fitness industry, I should say. But things just weren't working as they normally did for her in the past. So when we did her initial assessment, I mean, she was probably about maybe 40 pounds overweight, but she was more importantly becoming like insulin resistant. And she didn't realize that at the time. So we balanced her hormones. We took a look at her thyroid functioning, uh, cleaned up her diet. She was eating healthy, but there were some things that we just tweaked a bit that she didn't realize were contributing to her insulin resistance and not being able to lose weight very easily. And over a, it was a slower, gradual process, but over a couple of years, she got to a point where she started competing in bodybuilding competitions, and she actually won her pro card, which is kind of a big deal in the bodybuilding world to go into a competition and win. And she was in the figure category. So she really did this 180-degree turnaround. Um, and of course, like she's got way more energy, her brain fog is cleared up, sleeping well, just feeling so much better in general, more like her old self.
Well, hello, this is Don,
And this is Gina with Focused Healthy Family.
and this is podcast number 149. And today we're talking with Dr. Julie Ward with Balanced Body Functional Medicine. And Dr. Julie Ward is a compassionate and pioneering physician whose dedication to her patients and continuous pursuit of knowledge have defined a transformation medical career. With over a decade of expertise in functional medicine, she has become a trusted resource for those seeking a holistic approach to health and wellness. So, welcome, Dr. Ward.
Thank you.
It's great to have you here.
So the one thing I was wondering about, and this is where you could probably tell the story of your career, I guess, but it's like how you went from a medical doctor to a functional doctor.
Yeah. So, yeah, I was in traditionally trained, medical school, went through internship and residency, and was practicing basically primary care, urgent care for many years, working in smaller emergency rooms and urgent care clinics. And I was honestly starting to get a little burnt out of that just because it was sort of the same thing over and over. I felt like I wasn't making much of a difference. But when I started hitting an age where I started feeling really run down, like really fatigued all the time, um, and nothing, I was exercising, I was eating what I thought was healthy, but I was just super fatigued, and I was trying to prevent I was trying to prevent menopausal symptoms. I didn't really want to go through the traditional menopause. And so I was about 45 at the time. And so I started looking into or researching, what are bioidentical hormones? When would I need them? How are they given? All that kind of stuff. When I asked my GYN doctor at the time, she didn't really have much answers for me. Traditional medicine doesn't really teach or recognize hardly bioidentical hormones. And so the answers I was getting from the traditional medicine was just really kind of non-existent. And so that made me research more about bioidentical hormones. And that's when I discovered functional medicine. And it just seemed to make so much more sense to me. It just seemed so much more logical that you would treat the root cause of the symptoms rather than just giving a drug or some sort of treatment to stop the symptom. Instead of a band-aid approach, it's really getting to the root cause of what's going on. And so that's kind of how I got into it. Um, and it's just been really fascinating ever since, because there's just so many different little what I call rabbit holes that you can go down in functional medicine. Bioidentical hormones was kind of what got me started. But then, of course, you start learning about gut health and thyroid health and heavy metal toxicity and mycotoxins and just all sorts of other fascinating things that contribute to overall health. So that's how I got started in this.
Well, and you didn't really go down the like just general practitioner. You kind of gotten into some things that were well,
Specialty areas.
yeah, so I was kind of curious too as to why you went off of kind of not off the general practitioner part, but to these other things like the well the bio
Bioidentical
there you
hormones.
go,
Yeah,
that
yeah,
what she
yeah.
said.
Right, right. Yeah, I mean the traditional primary care kind of stuff in the insurance-based model just seemed like it wasn't very effective. We're prescribing more and more medications, and in general, the population seems to be getting sicker and sicker. More people have cancer, more people have diabetes, more people are overweight. They're struggling with this constantly. And when you go into a traditional insurance-based practice, that's what you're seeing. And it's how the system is set up. The system is set up so that you're seeing a patient every 10 to 15 minutes. You don't have time to talk to them about diet and lifestyle. You have time to write a prescription, and you're expected to write a prescription. If somebody has high blood pressure or high blood sugar, you're expected to write these prescriptions. And if you don't, you're going to get held to account for that. Maybe the insurance company won't credential you anymore, or that there's these standards of care that you have to meet. And so the system is really rigged to be reactive to people's um, you know to people's symptoms, and it's not really being proactive about their health. It's waiting until you get sick and okay, now let's deal with it. It's like, oh, we're
Yeah.
just going to watch your blood sugar, and okay, now you're at diabetic level, so now we're going to treat you with metformin and maybe then insulin, and there's this just, it's just but before that they're not really doing much to prevent it.
Well,
So
how do you see with what you're doing with the functional part? How does the kind of MD kind of fit with the functional? How do you blend those? Do you blend them together?
yeah, yeah, absolutely, because once in a while we do need drugs. I'm not anti-drug. I just don't want to only use drugs. And so as an example, I had a new patient who comes in and they're clearly diabetic. Their diet is out of control. They're not exercising. And so when I get started with them, I said, look, temporarily, let's put you on something like metformin just to get your blood sugar under control, because I don't want it to damage your body over this time, because it takes a while to adjust, for people to adjust to a new diet plan, new exercise regime, that sort of thing.
Yeah, that's the one thing about I know in working with my my doctor here is that the functional part takes a lot longer.
It
So
does.
people we want the pill that they pop in and boom, everything's done, kind of
Yes.
thing. And so
Yeah.
yeah, um, that can be really dramatic for them. Do what do your patients? What's the I don't know if I want to say the difference, but what do the patients really kind of come out with? I don't know if that's the right way to put it, but what do they do, what do they find out of it? You came up with a story of a person that they came out with it.
Hmm.
Do they come out with a lot more than what they do with the medical practice?
Just kind of the
Yeah.
difference.
Is
Yeah.
there a difference in what what they're feeling, or how do they come out of your practice versus
Well,
medical practice?
hopefully they're coming out with a little more understanding as to why they have this condition in the first place, and how we're going about reversing it. I think it's easier for people to follow a plan if they understand why they're doing it. Um, and so you know, there's a lot of education that goes on in our practice. When we talk to people, most people don't think that they have a gut problem because, I'm not having stomach issues. But a lot of our health issues really start from gut problems. And so if the majority of our immune system is actually housed in the gut, and skin problems are intimately related to the gut. And so if our digestive system is not working well, like nothing else seems to fall into place. And so we usually start with that as a basis, like let's evaluate how your digestive system is working. Um, and we could do that with what are the symptoms that you're having? Are you having bloating, gas, diarrhea, constipation? I do get a lot of people with chronic constipation. They're like, well, I'll have a bowel movement once every 3 or 4 days. And they think that's just normal. Um, when in fact it's not. It's not healthy at all. You're recirculating toxins if you're not pooping every day. Um,
Oh,
so yeah,
well, that sounded really good.
yeah. So yeah, I guess hopefully, and it just takes time. It takes more time than what a traditional doctor's office can give.
Yeah, I had a cardiologist that w- talking, I deal with stress with people, so he sat down with me, and I get like a 2 to 5 minute time with him. I mean, that my cardio, and he came in, he sat down, he did the little check on things, and asked me just a couple of little questions. Got up as he got to the door, he opened the door, and he went, oh yeah, I'm supposed to ask you, what about your stress? And
I
and
love
I
that.
said, well, and so I said, okay, and I said, well, and as I'm started, he left the room. I
Wow.
didn't even get the 2 words out about my stress, So yeah, I get that.
Yeah,
Um,
Yeah, they're
I
trained to ask that, but they don't really have any, you
yeah,
know, recommendations, just don't be
right.
stressed.
yeah,
Well, yeah, they're not really, in all fairness, in medical school residency training, like we're not given any training on stress and how to deal with it. It's just
Sure.
it's not part of the curriculum. But yeah, I had a similar experience with an orthopedic doctor one time when I went in for some hip pain, and he kind of like, okay, in the 3 to 5 minutes that he was there, he's like, I can put a steroid injection in that. I can give you pain meds, or we can do a hip replacement. And I was like,
wow.
no, no, and no. What about doing a PRP injection? And he's like, oh, well, yeah. And so it was like I had to really twist his arm to get him to listen about a PRP. And I'm like, there's so much evidence showing that a steroid injection in the joint is going to deteriorate the ligaments further. So you're basically guaranteeing yourself a joint replacement at some point if you do enough of these steroid injections into your joint. Why would they still be doing this? You know,
Well, yeah,
Like
I,
you
they
said, they're
they
putting
they do
band-aids
it.
on.
Well, they do it because insurance pays for it. It's a quick fix. It brings immediate pain and, anti-inflammatory, response right away. But over the long term, it's doing more harm than good. Um, so
yeah. Well, I mean that's a lot of different things because they talk about calcium's the same kind of thing, that yeah. Well, yeah. Um,
I'm kind of curious,
when you went to school for functional medicine, kind of your big eye openers as an MD, things that you kind of really surprised you, maybe even that you were learning about?
Um, yeah, I mean, even I remember the very first conference I went to learn about bioidentical hormones, and they were talking about metabolites. They were talking about all these herbal supplements. It was like a whole different language. I mean, it was like completely new, and just I really had to read and learn a lot about this because this was definitely not something that was taught at any stage of my medical training.
Mhm.
Um, but over the years, it becomes more familiar. You start to understand these things. But I think definitely learning about how profoundly our gut health affects our overall health was one of the biggest eye openers for me.
Mhm. Yeah.
Yeah, I think people don't. I mean, they actually kind of call the stomach like the second brain almost, as if
Yes, yes,
um,
it affects, yeah, because so many of our neurotransmitters are made there in our gut, and it affects mood, our immune system, just everything. So
well, now I also I noticed on your thing you talked about a fellowship with the anti-aging and regenerative regenerative
yeah,
that word in there.
regenerative medicine
Yeah,
associate.
that's
Yeah,
it. We Gina and I work with the elderly that aging
Aging population.
population. So
yeah.
I was just kind of curious as to what did that gain for you? What did you learn from that fellowship or that working with them?
Yeah, so that fellowship was like my main training for functional medicine, where I went through different modules that looked at, I started with bioidentical hormones, I did a gut health, I did cardiovascular, like there's different modules that you kind of go through. Um, and then, so I've picked up other, I've taken some brain health courses along the way and things like that, because, yeah, that's another interest of mine. That and it is fun because you can kind of pick these different things along the way. So brain health became an interest of mine when I was doing an online course about brain health, and I kept reading about how uh, hyperbaric oxygen chambers are so beneficial to helping with the brain and regenerating brain cells and things like that. And so I started looking into, well, how how hard would it be to get a hyperbaric oxygen chamber in my clinic? Because I think that would be kind of neat. And so that's when I kind of found this other organization that helps functional medicine doctors get into hyperbarics. It was the International Hyperbaric Association. And so after that, I got two chambers put in our clinic, and that has been really fabulous because hyperbaric oxygen is such a great treatment for so many different conditions. And it does such an excellent job of reducing inflammation and stimulating your immune system, um, and helping with people who've had traumatic brain injury or stroke, any kind of neurodegenerative disorder. It really improves the outcome. And besides, healing wounds really well, both internal and external. So it's just, and I love that it's non-invasive, right? There's no needles involved. It's 100% natural. You're just in this chamber, breathing a mask of 100% oxygen that sort of super saturates all your tissues with oxygen. So you're giving your body this rate limiting ingredient that it needs for growth and repair.
I'm curious, have you worked with anyone with Parkinson's and using the hyperbaric oxygen chamber?
I have not yet. I know colleagues of mine who own hyperbaric centers have, and I think with Parkinson's, it can really make a huge difference. But I would also recommend for anyone with Parkinson's to get tested for heavy metals
Mm.
because sometimes those can be the cause of some of these tremors. But you want to make sure that you do a provoked heavy metal test, which means like if we're testing for heavy metals, it's like a urine collection. But most of the time, you're not going to see these heavy metals come out in your urine because they're residing in your bones and your
Mm.
solid organs. So you really need to give yourself this chelating agent. There's a couple of them, but the main one is EDTA. And so you get an IV with some EDTA in it, and then you collect your urine for the next like 6 hours and send in a sample of that. And that's when you're going to see these heavy metals come out. And you'll see kind of, okay, there is a lot of whatever it is, lead, mercury, arsenic, cadmium. There's a whole list of them.
Interesting. Okay.
Yeah,
Yeah, I didn't
yeah,
realize that it could be dealing with heavy metals, but it's not showing up on basic testing because you said it's being
yeah.
stored in the organs
Right.
and things. And
Exactly. So unless you're doing a provoked test, you're probably not going to see evidence of heavy metals. Um, and then there's some other kind of hidden chronic infections that sometimes can mimic these neurodegenerative disorders like Lyme disease,
Mhm.
mycotoxin illness. We're here in Houston, which I fondly call the mold capital of the US, because we're just so, it's so humid here and we get floods all the time. Most of the buildings have water damage to them. So, it's a big thing to have a lot of mycotoxin in this area.
Well, yeah, Gina just lost her father, who was on Parkinson's for
Mm,
about 17 years, something like
yeah,
that,
yeah, he'd survived good 17 years with Parkinson's.
wow.
He passed this past fall, so the dementia was really what was the difficult part in the end. And it kind of got triggered when he first had back surgery,
Uh,
and um, and then COVID, just
oh yeah,
isolation. He was a
yeah,
man who was active and social, and just it really snowballed that dementia. And then a couple trips in the hospital made
yeah,
things, and they wound up having to reduce his Parkinson's meds because of the cognitive effects that the medication actually causes, the negative effects.
yeah.
And then that slowed him physically down. But yeah, it was difficult. But his last couple months, we moved him very close to where we live, and so I got to spend a lot of time with him. And
That's good.
yeah, he was very
Yeah.
ready to go by the end. It was just
Mm,
he didn't
that's so
have much
tough.
purpose in his life anymore. It just couldn't functionally do
Yeah.
things that he used to enjoy. But it seems, I work as an occupational therapist in geriatric rehab, and I just feel like there's more and more cases of Parkinson's
Ah,
than there used to be. Just what I'm seeing in my line of practice, and just wondering too about, it's one of those things they're still learning so much about. Are there, we know that's definitely linked with um, like pesticides and those kind of chemicals.
yeah.
There's a connection with Parkinson's, and I'm sure there's
Right.
probably other factors that we might not realize can be playing an underlying role.
Yeah. Yeah. Definitely. Definitely.
Um,
Well,
yeah.
I had one last question for you. Uh,
Okay.
on your website, I went over your website today like with a fine-tooth comb here, but I
Okay.
I saw this thing called the Health Hub that you have on there.
Okay.
Is that like a
It's like my
group
blog
or
page. That's
oh
just my blog
oh
page. Yeah. Yeah.
okay. And you
Yeah.
haven't gotten that started yet, right? Because that's still you're still working on putting it together, or do you still getting it?
There should be some blog posts on that health hub.
Oh, is that
Um,
what that I think at the bottom there was some maybe there were those
yeah.
okay.
Yeah.
I
There's just
I'm
some
sorry.
different topics that we put on from time to time. Yeah.
Your comb missed those fine pieces.
I know my fine-tuned code was very slim here. But
I'm
well,
curious with your practice. I know you're there in the Houston area. Do you do any virtual work as well?
So right now I'm just seeing Texas patients
Okay.
because if I
Licensure.
licensure issues, exactly. So they have to be in Texas.
just in the
Yeah.
state of Texas, not just Houston, but anywhere in
Right.
Texas.
Anywhere in Texas. Yeah. And we can see people, over Zoom or a different, HIPAA compliant platform. Yeah.
Well, this has been a really enjoyable conversation, and like I say, we could probably go on for forever
Yeah.
and ever on a lot of these things. But tell us a little bit about like how if there's anything going on with your practice that you want to get out. and how people can find you.
Well, you can go to our website. It's drjuliaward.com to get more information. Um, and I would say, so how we have our practice set up now, people, if they want to come in, we do this full functional analysis or this functional health analysis where we, before they come in to see me, they fill out a pretty extensive health history questionnaire and we do some pretty extensive blood panels on them. And then in the office, we have two different tests depending on what the concerns are. We've got one test called the glycocheck, which is and like I said, it's an in-office test that basically measures the health of your microvasculature system. So the smallest vessels in our, like the majority of our blood vessels are actually these really tiny capillaries, these 4, 5, and 6 micron diameter vessels, and they're all lined by a special glycocalyx lining. It's sort of like a gel-like matrix that holds the fluid into the vessel. And without this glycocalyx lining, the vessel sort of deteriorates. And so things that can damage the glycocalyx lining are, age and genetics, toxins, sugar, lack of exercise, so different things like that. So this machine that we have is like a probe that goes under the tongue and it takes these high-powered magnified videos of the vessels under your tongue. So it's measuring the density of these 4, 5, and 6 micron vessels, as well as the thickness of that glycocalyx lining inside each vessel. And then it does all these calculations, and it puts you on a scale from 0 to 10, how healthy is your microvasculature.
Hmm.
So that one's really good for people who have maybe issues with not just cardiovascular disease, but like if somebody is obese and maybe diabetic, we want to measure that glycocalyx and that microvasculature versus somebody else who comes in and like maybe they're one of their concerns is brain fog and not being able to remember where they put things or word recall and that type of thing. Then I'm going to do, instead of the glycocheck, I'm going to do a test called brain span. And this is where we take a few drops of their blood and we analyze it for free fatty acids, the omega-3, 6, and 9 composition, but in the red blood cell. So it's a little more accurate than in the plasma. And then there's a computer portion of a test that they do that gets emailed to them. It takes 15 to 20 minutes, and it tests things like, short-term recall, it tests cognitive flexibility, executive functioning, so these different things. And then it collates or puts together all these results. And it says, here's a snapshot of your brain function right now. This is what it is. And here's ways that you can improve your scores. So each one, it lists out different ways that you can improve your scores in these different areas. So they get one of those tests in addition to all the blood tests. And then, so when they come in to see me, then we can kind of put everything together and say, this is what I would recommend for you moving forward. And typically, it's not a quick fix. It's going to be a process of turning somebody's health around or being very proactive. And so we have a membership program where people, get so many visits in a year. They get unlimited use of our infrared sauna. They get, there's different things in this membership program, but it's a commitment so that, because it's not something that, oh, here's 1 or 2 supplements and you're going to be on your way. It's not a
Yeah.
prescription and you're done. It's a process of, let's look at your diet. Let's look at your exercise habits. Look at the mindset is a big one too. Because so many people have a lot of stress. Maybe they have a lot of trauma in their background, and that blocks their ability to heal if they're not dealing with it. So we also want to address mindset.
Well, it sounds wonderful. It sounds like it's probably about a year long process for is
Yeah,
that what?
yeah,
Yeah.
it's about a year long. Yeah, yeah. And then after that, they can, kind of drop down to more of a maintenance type of membership level.
That sounds great.
It's amazing how many different things, tools that there are out there. I mean, we've talked with other functional medicine doctors over the years, and just, I'm learning new things all the time about testing that's available. And, it's a shame that it can't be more found,
Yeah,
mainstream, just as far as, I mean, it's,
yeah. But
and
they're starting to become a little more available. I have one food allergy test that we can now run through insurance.
okay.
And so not everybody's insurance, but
Some,
like some of the major insurance ones. And this food allergy test is actually looking at IgE, which is a true allergy,
mm-hmm,
IgG, which is a true sensitivity, and it looks
mm-hmm,
at complement, which is part of the innate immune system that when it's present, it makes inflammation worse.
okay.
So that's one test that at least is moving in that direction. And I think just recently there's a lab called IGenX, which is about to get some of their Lyme tests approved by Medicare. And
Oh,
so
wow.
that's huge. Yeah,
Mm-hmm.
because Lyme testing in the past has been not great, not very accurate. Most of the time it comes up negative when people do in fact have Lyme. But these more specialized testing, it looks like they're about to be, or maybe they have already got some of them approved.
Well, thank you
So
for
yeah,
sharing all these different things. It's, just, and for anybody who's in the Texas area, how can they learn more about your practice? I know you mentioned your website before.
yeah,
Um,
and
uh,
they can give us a call too. Should I give you our phone number?
You can put it on there. We'll also have it out there
Okay,
on the description too. But sure,
description.
you can
So
put it on. That'd be great.
yeah, yeah, because some people are like much more just, I need to talk to a person. I
Yeah.
totally relate to that. I like talking to people. I don't like automated stuff, but it's nice to look at the website too.
yeah, yeah, we'll
Yeah.
definitely share all that. So
Yeah.
thank you for being here with us today. Dr.
Thank you
Ward,
for having me.
is there any
Yeah.
last message you'd like to send to our listeners, or anything for them to pay attention to with their own health? Or
Um, I mean, I did want to mention that we also offer ozone therapy. We didn't really get a chance to talk about that, but
yeah.
there's more information of that on my website. Um, but I would say the biggest recommendation for health in general is to do some sort of movement. Don't you've got to exercise or at least walk or do something that gets your body moving. Besides that, and avoiding as much processed foods as possible.
And maybe we can have you on again to talk more about the other aspects of your practice, because there's so much to it. So thank you for being here today with us. We really appreciate it. Um,
Thank you so much.
to our listeners, we hope you've enjoyed this podcast. Do check out the notes where we've got more information to learn about Dr. Ward and her practice. If you've enjoyed this, please leave a comment, share this with other people that you know. You can share it via YouTube or anywhere you're listening to this on a podcast. Also, if you have more interest in learning about Don and I and our journey, going to focusedhealthyfamily.com, you can see our other podcasts that we do, our other programs that we do. You can look at our caring for aging loved ones and the Ask the OT discussions that I've been doing with people, and the talks that Don and I are going to be doing more of, helping people navigating this journey. And it's really about the juggling act of caring for yourself and your other loved ones. And taking care of yourself is so essential, because as a caregiver, that's putting extra strain and stress on your body and can be affecting you without even realizing it. So please check us out, Focused Healthy Family. You can find us on Facebook, on Instagram. Again, like I said, we're both on YouTube and where you listen to podcasts. And be sure to tune in January 28th, 7 p.m. Eastern Time. Don does about twice a month. He's doing EFT tapping sessions, group calls. You can join in on the session he does over Zoom to learn a little bit about tapping and have that experience. And remember, how you speak to your children and your loved ones today shapes their future and yours.